It's 2 a.m. and you wake up drenched in sweat. On today's episode, we're going to have a look at night sweats, what they are, what they aren't, and some things that you can do to try to help alleviate some of those symptoms. I'm Jay, and this is Somnilopod. Welcome back, everybody. I hope you're doing well. A couple of weeks ago, I had an episode of night sweats. Woke up in the middle of the night and I was drenched. So I thought it might be interesting to have an episode about night sweats and talk a little bit about some of the things that cause them, some of the things that contribute to them, and some things that we can do to try to help take care of them. Now, as the name implies, night sweats are episodes of excessive perspiration that occur during sleep. They're often described as, waking up soaking, drenched, just like I pointed out. Many times you have to change your clothes. Sometimes you even have to change the bed sheets. Now, it's important to remember, night sweats aren't simply overheating because of a heavy blanket or excessive temperature in the room. Now, night sweats are distinct from simply overheating. That just simply occurs because of maybe a heavy blanket or your pajamas are too thick. Maybe you grabbed your winter pajamas instead of your spring pajamas. But in either case, they are distinct from just being hot. So how common is the problem? Some of the estimates are that 15 million Americans suffer from night sweats. In one study that was published by the National Institute of Health, 41% of the patients studied said that they had had an episode of night sweats in the last month. Now, interestingly, most of those patients were between the ages of 41 and 55. Some of you may be able to link these puzzle pieces together ahead of me, but symptoms of menopause typically start between 45 and 55. And unfortunately, night sweats is one of the main symptoms that people experiencing menopause get to suffer through. Sorry, ladies, it's just part of the row that you have to hoe. Interestingly, there is a disorder called, or there's a process called andropause that men go through as well. And it affects the levels of the testosterone that we have in our systems. And night sweats can actually be a symptom of that as well. So you can see that hormone issues can have an effect on the development of night sweats and the intensity of night sweats. But hormone issues aren't the only things that can cause them. I was interested to find out that there are a lot of other disorders or diseases that can contribute to night sweats. One of the more common ones, infection. If you've got an infection of some sort, especially if you're running a fever, night sweats can be very common associated with each of those. Anxiety disorders can also affect night sweats. And some of the treatments for anxiety disorders can help alleviate the night sweats as well if they're associated with that. Autoimmune disorders, things like thyroid disorders, even some cancers can affect night sweats. Now, since this is a podcast about sleep disorders, I would be remiss if I did not point out that night sweats can often be associated with disorders like obstructive sleep apnea. With obstructive sleep apnea, the patient is actually struggling to breathe, so you're working a lot harder than you normally would. So excessive sweating at night is a very common symptom of sleep apnea. Now, hopefully, most of those more severe symptoms or more severe diseases you're not actually suffering from. Hot flashes can occur just randomly, but as I mentioned earlier, they do tend to start as we get a little bit older and can have an impact on our ability to get a good night's sleep. Now, how are night sweats different from hot flashes? Hot flashes are a common symptom of menopause as well. The hot flashes are simply a sensation of warmth, and they can occur anytime during the day, morning, noon, or night. as some of you probably have experienced. Interestingly, when they do occur at night, they are associated with episodes of heavy perspiration, so they are then classified as night sweats. Now, it's important to remember that they are not associated with the flushing that happens with hot flashes. Flushing is just the reddening of the skin because of the blood vessels the increased blood flow to the skin. But that is distinct from the hot flashes that many women experience. Now, while night sweats can be bothersome, they aren't necessarily something that is a serious disorder or something that you may necessarily need to talk to your doctor about. However, once you do reach a certain point where they may become very frequent, if they're persistent over time, then you may want to touch base with your doctor. Because as I say, some of those symptoms or some of those contributing factors can be very serious. In one study, of the 900 participants that were asked whether they talked about their night sweats to their physician, the majority of them did not even mention it to their doctor. So it is something to pay attention to. Again, if it is something that is persistent or happening over time, or if it's interfering with your sleep, insomnia can often be associated with night sweats. So if you're not getting enough sleep at night, you're having symptoms during the day of daytime fatigue. You may even have some general feelings of just being unwell. It's important to talk to your doctor about that. Also, recent weight loss would be an indication for you associated with night sweats, would be an indication for you to talk to your doctor as well. Now, as far as treatments are concerned for night sweats, interestingly, behavioral therapy can be effective for night sweats. This was something that I had not been aware of. Cognitive behavioral therapy can help reduce the amount of night sweats that patients experience. Also, some medications can help, but for the most part, the physicians want to try to treat the underlying symptoms or underlying disorder that the patients have, the night sweats are a symptom of. But barring all of that, there are some things that you can do to help alleviate some of those symptoms. And some of them are very straightforward. Sleeping in a cooler bedroom. The temperature of your bedroom we have discussed in the past. It's something that you need to try to keep relatively cool, simply because your body sleeps better when it is cooler. But also you want to try to make sure that you're wearing comfortable, breathable clothing, but you still need to make sure that you are controlling the temperature in your environment. Also, you want to try to avoid caffeine, alcohol, and spicy foods before you go to bed, at least for a few hours. All of those things can help to increase the internal temperature and help lead to some night sweats. Some people find that drinking cold water before going to bed can help. That is something that there is a lot of individual difference with, so if you can try that and it helps, more power to you. Maintaining a healthy weight. If we're overweight, we tend to have some other health issues that can contribute to things like sleep apnea and being able to get a good night's sleep, which can cause night sweats. So we want to try to maintain a healthy BMI. As I mentioned earlier, cognitive behavioral therapy, but also some relaxation techniques can help reduce the incidences of hot flashes and night sweats significantly, especially in menopausal women. These are things that we have talked about in the past. Some PMR, progressive muscle relaxation techniques. Those are some things that can help alleviate some of these symptoms and get you sleeping a little bit cooler throughout the night. I hope that this has been informative for you. It was fun researching this. It's not something that I had really given a whole lot of thought to in the past, especially where it wasn't necessarily associated with a specific sleep disorder. So please take this information, use it as you will, and please remember to follow, like, subscribe on all of your social media services that you follow me on and all of your podcast services. Until we meet next time, please remember to try to make sleep a priority and get some rest.